Yeah, hello guys, it's Dr.Chudi Ufondu of Snowspirations, Global Health Solutions, and also of Axe Gynecologist. So I wanted to talk about the issue about donor egg and donor sperm. So most times, people don't understand the concept. Thinking about donor egg or donor sperm, it's a very tough decision for the two people involved. Very, very tough. It's not for faint-hearted. So it's something you will need to understand exactly the details. Now, you have to also understand the genetic implications. You have to understand your reality. And it's meant for two consenting adults. That's the lady and the partner. Now, there are three parties involved in any donor egg or donor sperm situation. The two parties already are known to themselves, so the lady and the guy, who probably might be married or they're in a relationship, and for some reasons they are having problems using the lady's egg or using the guy's sperm. So there are some medical situations that people will find themselves in this position. So there are some women that might not really have adequate eggs, so they might have poor egg reserve. Remember that as you're getting older, your eggs are also getting older. So there is a particular stage you will get to, you won't have both the quantity and the quality eggs you can use to bring forth your own. Now, in the same vein, the man can also have some issues with the sperm. So if the sperm is not of good quality, so if the sperm doesn't have very good indices like motility, like morphology, and the count, then there might be a need for the man to go for donor sperm. So it can be donor sperm, it can be donor egg. Now, you need to understand that the most important thing at the end of the day for two consenting adults is to have babies. A baby is a baby. There is absolutely nothing wrong in going for donor sperm. There is absolutely nothing wrong in going for donor egg. If that's your option, go for it. I support it 100%. Now, you have to understand that the three principal parties involved in any donor egg or donor sperm is the two individuals. Then the person you're going to use the egg or the sperm. And most times, that person is a blind, kind of nobody knows who that person is from both the perspective of the provider and the couples. So it's always better to go for blind procedure. So you're not supposed to know who that person is, but that person is going to be taken through due process. So it's not an all-comer thing. Before we actually shortlist someone to go for donor eggs, there are so many investigations, there are so many tests, there are so many, due process that needs to be followed, both legally, medically, psychologically, and everything. So one of the criteria is the fact that that lady has to be a younger person. That man has to be a younger person. That's a very standard protocol. Then we rule out so many chronic conditions. Once we know that that lady is fit, so there are so many tests the lady must pass through, and if she's certified fit, then the whole thing will begin. Now, the genetic component of that baby is going to be comprised of the three of you. But the mega bulk of the component will come from that donor egg and your partner's sperm. Now, you as the mother will also contribute a lot, because there are periods we call preconception period, prenatal period, and postnatal period. So even before you become pregnant, you've already started building your body to be a mother. So you have a very strong influence to the development of your baby's brain, to the development of your baby's immune system, to the development of your baby's metabolism. So while the baby is growing inside your womb, in as much as that genetic makeup can come from the donor lady, you have a greater role to play. Now, if you focus just on what the baby will look like, or who the baby will resemble, or if the baby is going to have the genetic component of the other lady who is helping you guys, then you might end up spending the whole time wasting it on things that don't matter. The most important thing is, God willing, by the time, the baby is transferred into your womb, you guys are going to have your babies. And guess what? Even in our culture, if you guys are very respectful of each other, if you guys keep your secrets, the only people that should know about the fact that you use donor egg is your doctor. That's the only person. So you're not even supposed to tell anybody, including your mom, including your siblings. So there is absolutely nothing wrong in doing that. And I will encourage you to go for that if that's your option. The beauty of anything I'm telling you is the fact that it has happened before. So you might even be lucky. You might go and have twins or triplets or quadruplets. And that will be the end of your heartache. So it needs a lot of maturity. It needs a lot of discipline, a lot of understanding. So you're not completely going to be eliminated in the whole baby making situation. You're still going to contribute a lot. You're going to contribute maximally. And remember that how the baby is nurtured also shapes who that baby is going to be. So let's focus on important things. If donor egg or donor sperm is the only way for you to become a father or a mother, please don't hesitate. Jump on it. Go for it. Have your baby. Determine what makes you happy. Don't allow the society or people make you feel like you're inferior. Like I said, a baby is a baby. It doesn't matter if it's vaginally delivered. It doesn't matter if it's adopted. It doesn't matter if it's fostered. It doesn't matter if it's donor egg, donor sperm. We don't care. A baby is a baby. Okay? So enjoy the rest of your evening. And please, if you're going for this, make sure you understand it fully. It's not a game of the faint-hearted. It's a very serious issue. Okay, enjoy the rest of the evening. And thank you and bye-bye.